very impressed by the large attendance, and I was quickly going through the introductions and seeing that we have quite a good mix here. And before I start, I would like to encourage you to please post your questions on the chat as we go along. And also to mention that let's have conversations. I know this, as we say, it is a workshop. Yes, I may be sitting on this side as a facilitator, but I always believe on a two-way conversation whenever we have a workshop or training, because I can't like say that I'm the holder of every knowledge that there is. So feel free to even chip in, add something that you feel will be of benefit to the rest of the attendees. So this being a workshop and it is virtual, I'm hoping we are going to be interactive, have conversations. I'll be pausing in some sections to maybe ask a question, and it sort of helps me gauge what we understand on some of these basic terminologies when it comes to systematic searching or systematic review. And somewhere halfway through the presentation, we're going to have breakout sessions, sort of to apply most of the things that we have learned before I conclude the session. So I'm just going to share my slide, maybe Fortune. Okay, thank you. All right. So here we are. As was mentioned, my task today is to take you through, or rather to facilitate on the basics of systematic literature search. And my understanding from the flyer, I understand this is a series of workshops, and this is really timely to have a start in terms of being sure that we understand the basic terminologies when it comes to what a systematic literature search is before people dive into the actual searching. So my objectives today are as indicated there: understanding the basics of systematic literature search, which of course forms today's topic, how to extract such concepts for the purpose of searching, and leading us into how do we develop such strategies, and most importantly, the techniques that are available that one can apply to develop such strategies. I believe we also have experts in the room, and like again, I would like to just urge, if you feel there's something you need to add, please feel free to put it on the chat. So as a way of starting, we have done our introductions, but I would just like, just by posting on the chat, what is your understanding of a systematic literature search? You could please post on the chat. Before I give my definition, I just want to hear from you. What is your understanding of a systematic literature search? Please post on the chat. Searching for available literature in a systematic way, yes. Let's have some more suggestion. Is the way of searching keywords for a specific topic? Yes. There are actually no wrong answers. We are all saying it in an orderly way of searching. I like the word transparent, reproducible. A structured search for available literatures in a specific topic. A rigorous, so we can hear the word reproducible, rigorous. Structured, transparent. All these are very important terms that you have used. Looking for sources to address a research question in a systematic manner. So yes, you are very right. You have actually used the words in my definition that a systematic literature search is basically a structured, comprehensive, which I know some of you said rigorous, and reproducible process for identifying all relevant. All would be, I would put that in quotes, because the more rigorous your search enables you to produce all the relevant studies. So your relevant studies are actually depend on how you develop your search strategy. And in the chat, you made reference to a specific research question, and that is very important. So the key features are a predefined strategy, transparent, documented, and aims to minimize bias. I felt that it's important that we understand the difference between a systematic search and a narrative search, because a lot of us are used to doing literature review, and we go in and do a literature search, and you find when you do a literature search, it would be different from what we refer to as a systematic literature search. And that's along the lines of the approach, the goal, the documentation, and the reproducibility. So you find when it comes to the aspect of approach in a systematic search, it tends to be more structured and protocol driven. And when it's a narrative search, it may have some bit of flexibility and it might be more informal than the systematic search. In terms of the goal, a systematic search would be comprehensive and unbiased, while the narrative is selective and may reflect some bit of author bias. Documentation is also very important when it comes to a systematic literature search, because it should be fully documented in terms of the search strategy. Where did you search? On what date did you search? But in a narrative search, we really provide that kind of documentation. So in terms of reproducibility, in fact, transparency, systematic literature search tends to be more transparent than the narrative search. And in terms of reproducibility, it's high in the systematic literature search and tends to be lower in the narrative search. So an example of a systematic search would be where maybe you're looking at all the RCTs. For those maybe who are not in the health, RCTs are randomized controlled trials. So you could be searching for randomized controlled trials on diabetes interventions within a certain time frame in specific databases. If it is a narrative, you'd say, well, I want to just look for a few recent articles on diabetes treatment. So that would fall within a narrative search. Systematic literature search, a systematic literature search is a key and it's an essential step in conducting a review. And I don't want to stick to the word just systematic review. I know we are not discussing types of reviews, but just to mention that there are very many types of reviews. But for specifically, if we're talking about a systematic review, this is a step that is essential because it forms the foundation of your the outcome or the quality of your systematic review. And when we talk about systematic review, it is what we refer to as a form of evidence synthesis. And the reason I'm using the word evidence synthesis is because within evidence synthesis, there are various types of reviews within there. So maybe perhaps we would ask ourselves, what is evidence synthesis? Basically, when we talk about evidence synthesis, and this definition brings or sort of elaborates the importance of why a comprehensive literature search is important, is because when we talk about evidence synthesis, it's a process of bringing together information from a range of sources and disciplines to inform a certain issue. And within the chat, you posted and talked about maybe answering a research question. So it includes a methodical and comprehensive literature synthesis focused on a well-formulated research question. So you cannot detach the search, you cannot detach the search from the research question, because you must have a research question and then you develop the search strategy to ensure that whatever literature you're retrieving is intended to answer that particular research question that you have. So in evidence synthesis, like I said, is to synthesize, and you conduct the search in an unbiased and reproducible way to provide evidence. And that, I think, is the key word here for practice, policy making, as well as to identify gaps in the research. So when it comes to the components of evidence synthesis, there are all those other components that are there. But for this particular session, I'm just going to concentrate on the methodological comprehensive literature search and how do we go about that. And you can see this literature comprehensive, reproducible keeps coming up when we talk about systematic review or evidence synthesis. So it is very important that we are very clear on how we conduct the literature search in an unbiased and reproducible way. So why is a systematic search important? I think I've already alluded to that. It ensures completeness. It reduces bias, to avoid cherry picking from different studies. It supports reproducibility. And like I had said, it is the foundation for systematic reviews. High quality evidence synthesis depends on a robust search. So this is recognized as a critical component of the review process. So now, regardless of the search tool that you're using, the development of the search strategy is very, very important. And that is if you hope to obtain satisfactory results. And these results, remember, whatever you retrieve will influence your outcome. And for those who are in the health field among the attendees, I'm sure you understand when we talk about evidence and the evidence pyramid. When you talk about the evidence pyramid, at the top of the pyramid, you'll find things like systematic reviews, meta-analysis, and all that. And you find the reason that they're at the top of the pyramid is because of this synthesizing of the evidence for the outcome. And that you can only have it at the top of the pyramid if you carried out an effective search strategy to inform your outcome. So how do we get started when it comes to a systematic search? So this is just a workflow that I tried to think of when it comes to a systematic search, and I'm going to try and address these areas that are very important in the systematic search. You need to align your search strategy to the question, and that already was mentioned by one of the attendees in the chat. So you cannot talk about a search strategy without going to your review question, because that is what will guide the search. Then you must select the databases, and we are going to talk a lot about that, because you identify the key databases and the other sources that you are going to search, and that will influence, because the databases are also going to influence how you're going to conduct your search. You then develop your search strategy using the various search techniques that are available, and we are going to have conversations around the search techniques and the importance of carrying out what we call an exploratory search in what you will identify, depending on your question, what is your master database. So you need to carry out an exploratory search in your master database. And once you do that, the next step is how do you translate that search in the other databases? So when we talk about aligning the search strategy to the question, identifying the search terms or the keywords or concepts, the thing that comes up is how do I go about identifying my concepts? Because when you have a question, you need to break the question into searchable concepts before you combine using the search techniques. And to combine to identify concepts, there are various ways that you can go about it. And one among many is the use of what we refer to as frameworks. Again, I would like to pause here and ask, have you heard of frameworks, and what's your understanding of these frameworks? You could please post on the chat. I mentioned that one of the, okay, we are now diving into identifying such concepts. So how this works in a nutshell, you have your topic. Then from your topic, you come with a research question. Then from your question, you have to extract concepts or what you call keywords or search terms, which you now use to develop the search strategy. So within this developing or identifying the search terms or keywords, there's what we call frameworks that can guide you in extracting, if I can call that. Yes, I can see somebody has posted PICO. Yes, those are the lines of the frameworks that I'm talking about. And those frameworks, yeah, the PICO, Prospero, well, this PICO, Spider, now we are talking about the frameworks that I'm referring to. So you find these frameworks have been developed for that purpose, to help us extract the search terms. So basically, when we, okay, yes, all right, that's what I meant by the frameworks. So basically, frameworks are used to break up the research topic into key concepts and may be used in the developing also of the research question. So there are various frameworks. Some people refer to them as mnemonics, and this can assist you break up your research topic into key concepts. And what happens is whichever framework you choose, basically they answer the 5 areas. You find that when you have a framework, it basically helps you break your research question into the different areas of who you, because you want to ask who, what, when, where, and how. So basically that is what the frameworks do. So as much as these appear common in the health sciences, there are a number of frameworks beyond the health sciences, and also not limited to quantitative studies, but also qualitative studies. And it's for this reason you find that whenever we talk about frameworks, the first thing that we always hear about is PICO. Because you find when you talk about, if you look at the literature and systematic reviews, it has quite a lot of history within the health sciences. But you find that it has evolved over years, and it's not only limited to the health sciences. And in most cases within the health sciences, you'd find that when we talk about systematic review, everyone would think about a quantitative study where you have a problem or a population and you have an intervention and looking at a certain outcome, and more on what we'd consider quantitative studies. But over the years, like I said, this has evolved beyond health sciences and also beyond quantitative studies as well as qualitative studies. So supporting the reviews in the various disciplines has seen the emergence of a number of frameworks or mnemonics. So the first, and would I say the most common for those who are familiar with, is the PICO. And basically what PICO does, it's why it's called a framework is because the P, the I, and the C all stand for something, where the P stands for the patient or population. And some people actually say problem. The I is the intervention, the C is the comparison, the O is the outcome. Now within the PICO, this framework has evolved to the extent where we are even seeing PICO with some extensions, like a PICO with an M, PICO with a T, PICO, PICOT or PICOS. So where you find the extension of the M would be referring to maybe the methodology. The S could be the study design. Other frameworks that exist are PICO, and this is a PI with a small o. So this is different from the PICO. And the difference with this is that you find it's more for qualitative studies because it is population and the I is phenomenon of interest. The CO is context. That's why it is a CO at the end. Others, like you have already posted on the chat, we have spider, we have spice, we have eclipse, and this is just a few of the many frameworks that exist today. So like I said, the reason that we are seeing a number of frameworks that have emerged over the years is because of the need to support reviews in various disciplines beyond the health sciences, one, and secondly, beyond quantitative studies to also include qualitative studies. So I will just give you an example of a PICO, how to apply a PICO example. So you may have a question like what there is there. And I just try to look for a basic question. In adults with hypertension, does a low sodium diet compared to a regular diet reduce blood pressure? And I try to look for a question where, even though your strength is not in the health sciences, I think when we talk about hypertension and blood pressure, everybody's very clear what that is about. So when you have a question like that, what you do is you come up with the framework and you extract the concept. In this case, the problem of the population would be adults with hypertension. The intervention would be low sodium diet as per the question. In this particular question, you can see there's a comparison. The comparison being regular diet. But I would like to mention that whenever you're using the PICO, it's not in all instances that your question has a comparison. The things that are standard that you have within the framework, you definitely have a problem. You definitely have an intervention, and there's an outcome you're looking at. You may find somebody who has put a PICO and the comparison, if you don't have a comparison within your question, it doesn't mean that there's something wrong with your question, because the comparison could be no comparison. So don't worry too much that you must always have a comparison. So once you break out, you extract your concepts using the framework such as PICO, and that is just one example. You're now able to come up with what are the concepts that I need to use to search. And you can see that now these concepts are aligned along the lines of the way I had put the framework of the P, the I, the C, and O. And you will notice that within the line of each concept, you will see other terms within that. And that's the essence of coming up with a comprehensive search. Like within the population, my first population there, I had said adults with hypertension. But I know that hypertension can also be referred as high blood pressure. So whenever you're doing a search, you always have to remember that for every term that you use, is it referred to in any other way? That's one. Does it have a synonym to mean the same as that particular term? And these are very important things to put in mind. If it's the intervention, there's low sodium diet, salt restriction diet. So these are just synonyms for the different concepts that I've extracted for that particular search. For the outcome, you can see there's blood pressure reduction, systolic blood pressure, diastolic. So you have to think along the lines of alternative terms. You have to think along the words of, you even have to think along spelling. So there's synonym, there is alternative terms, there is spelling. What do I mean by spelling? Like, I'm trying to think spelling like, oh yes, the difference between like British and American spelling. are very important when it comes to searching, because you might find like you may be looking for some information where maybe the information is prevalent within a certain geographical area. So you find that if you did not factor in that spelling within from the British spelling, you might miss it out. One that I can think of is, I'm trying to think of one, like cesarean section, for example. When you talk about cesarean section, there are those who would spell it as CAE, and there are those that would spell it as CE. So those are things that you really need to factor in when you're developing your search string. Oh yes, I like the suggestions that you have put. Tumor and tumor. I think the British spell it with a O-U-R. The Americans just say O-R. And there's even hematology, H-A-E and H-E. So these are very key when you're doing your search. Now, you may have a framework and you feel like you're struggling a little bit with trying to fit your concepts within the framework. And that can happen because not all topics will fit perfectly into the framework. That's one. Or not everything will fit within, which I'd already said, will fit within every component of the framework. So you just apply what works for you. And I would like to put at this point that don't feel too tied to frameworks, because some people are very good with just looking at a research question and coming up with the concept. But the reason I'm bringing out the frameworks is in case you're having a challenge extracting the concept, that it's important to know that there are these frameworks that exist. They have been tried and tested, and a lot of people use it within their studies. You can also use a concept map if you feel like the framework isn't working too well for you. And when you talk about a concept map, you use it to, extract, to develop important concepts and the relationships for your project. And how this works is, in the middle, you can see this is a very broad sort of topic. Like maybe I'm thinking of an article or topic on storytelling. So what concepts am I able to think of? And that's why it's called a concept map, because it's things that you're bringing out from your concept, or a mind map. So how this technique works is you start with a broad topic or problem, then you just begin writing down all the words and phrases and ideas related to that, then map them to the original area, and then you can identify which are the key ones to be able to help you with your search strategy. So the goal of the systematic review evidence search, therefore, is to identify all the studies that contain data that are pertinent to your research question. And this I've already alluded to this, the comprehensiveness, transparency, and reproducibility of your search. And another thing that is important, when we talk about comprehensive and transparency and reproducibility, you cannot just decide the angle that you're going to take. Whenever you're carrying out a review, or when you're doing a systematic review, these are guided by guidelines that exist. There are different guidelines, and there are guidelines for conducting, and there are also guidelines for how you report. And these are a requirement whenever it is that you decide to embark on a systematic review. For example, when it comes to the literature search, it is expected within the guidelines And I'm sure, I don't know, maybe you've heard about the Prisma flow diagram. You find that when you look at any systematic review that has been published, within the Prisma guideline, you have to indicate which database did you search? How many articles did you get from this? And so on and so forth. And within the appendix or supplementary information, even some places where you're expected to submit, the additional information you would have to submit, they would ask for your search string. So these are the guidelines that you need to know, and it's important that you follow these for the rigor that is expected of a systematic literature search. So before, we have now talked about how to extract the search terms using maybe a framework or a conceptual or mind map. And before I move to the next area, are there any questions or comments? I will just take time and go into the chat. Oh, all right. Okay, fine. I can hear questions about, yes, we will definitely share the slides. Yes, Alan, there's somebody who's raised his hand, Alan Baguma.
Yes, good afternoon. Thank you so much for the presentation and the having us for this training. I have one small question. Some people, when they are when they are developing the framework, they only focus on PICO. They don't use any other frameworks, irrespective of the research question. Can you advise that? Is PICO like a general framework, or you have to use other frameworks? As in, can I still use PICO for any other research question? That's my question.
Thank you very much for that question. The slide that I showed a variety of frameworks, it was to explain that the reason we hear so much about PICO is because when we talk about systematic review and meta-analysis and all these, you find the history of this kind of reviews is really, like, do I say, deep in the health sciences. And within the health sciences, you find that the PICO was the one that was developed. Actually, I think the PICO was the one that was developed first. However, and I think I can just go back to that particular slide that I explained that. But we find that there has been an emergence of reviews in different disciplines. That is one, beyond the health sciences. And secondly, not just only within the health sciences, even not beyond quantitative. Because if you look at the initial studies, everyone used to think that when I do a systematic review, it has to have like a quantitative angle to it, where you're talking about an intervention and you're looking at quantitative studies. But that is not the case now. You find that we are having even this systematic reviews or scoping reviews or all these different reviews, even in the social sciences. That's one. Secondly, we are also seeing reviews that are not only in quantitative methodology, that way is also in the qualitative. And for that reason, that is why we have seen an emergence of a number of frameworks to answer your question. So beyond the PICO, which you find that if you are doing a social science and maybe qualitative, you might struggle using the PICO, and that's a reality. And hence, you find we have the PICO. If you look at PICO, the P and the I, the P, yes, talks about the problem or population, but the I is actually phenomenon of interest. So already when you see that PICO and the CO is context, already that tells you that is a qualitative. So you don't have to be stuck with that PICO. And these others I had put were just to demonstrate that there are very many others. I just have to try and remember what this stands for, like spider. Spider, the S is sample, the P is phenomenal of interest, the D is design, the E is evaluation, and the R is research type, and so on and so forth. There's another one called SPICE, where the S is the setting, P is perspective, I is intervention, C is comparison, E is evaluation, and so on and so forth. So I hope this answers your question. Say that if it doesn't fit within the PICO, look for the framework that works for you. That is one. Yes, I have seen spider, sample, phenomenon of interest, design, evaluation. And when you look at some of these, they are more or less that if you read the literature, quite a number of these are an offshoot of PICO, but considering other disciplines and also considering the qualitative angle of the study. I hope that answers your question. All right. So the next area that I'm going to talk about, which is very key when it comes to literature searching and with something we must be very clear about, is database selection. Kindly, if you could post in the chat. Of course, this already tells you the answer, that it is important to search multiple databases for evidence synthesis or for systematic reviews. But there's a reason that I want us to have a discussion along this, because it will inform part of the slides that I am going to discuss. So what is the important, why is it important to search multiple databases when you're carrying out a review? Okay, for credibility, to cover many data needed, yes, to capture all existing relevant papers. Unbiased. Remember, there was this word unbiased. And at the end of the day, you need to make sure you have captured as much as possible. Comprehensive coverage. Yes, I like that word, comprehensive coverage. To meet the objective of comprehensive literature and lack of bias. When it comes to systematic literature search, remember, and I made reference to the evidence pyramid. There is a reason why we have those reviews, like systematic reviews and meta-analysis at the top. It's because when we talk about primary and secondary literature, so when it comes to a systematic review, for example, it means you are not collecting primary data. And that's one thing we need to be very clear about. You're actually using data that exists, and you need to synthesize the data that exists. And in most cases, you find it could be an area that maybe there's some gray area, or you're trying to come up with a decision for practice to inform policy. And when you want to inform policy and you say that you have synthesized the data, the first thing somebody does is to go and find out what is your coverage of the literature that you extracted to synthesize, as this literature that you synthesized will inform your outcome for it to be considered what you'd consider it like level 1 evidence, and it can be applied without or somebody doubting why you have come up with that recommendation. So you're very right with all the answers that you have put: comprehensiveness, interdisciplinary topics to minimize bias, also to find gray literature, because another thing we need to remember that when we are doing reviews is that not everything is in the mainstream databases. So as we are doing searches for the literature, we also have to have at the back of our mind that there's some literature, there's the information that you might not get in the so-called, what we call mainstream peer-reviewed journals. And that is what we call the gray literature. And it could be perhaps maybe geographical scope. So that is some of the reasons that you need to search multiple databases. So we talked about comprehensive, relevant, and for the purpose of high quality evidence. So just in a nutshell, again, like I said, we're having conversations so that we make sure we have a two-way conversation. I will be asking questions as we go along. On the chart, could you list some, I can remove the word key, but some of the databases that you may be familiar with or you use? PubMed, Scopus, Google Scholar. Okay, thank you. I can see quite a lot. You have very good ideas. PsycInfo. In fact, another reason for using a certain kind of database, there are different kind of databases. There are databases that are specific to a certain field. Like when you talk about PubMed, you definitely have a health. You're working on a health question. If you're talking on databases like I'm seeing you posting Scopus and Web of Science, those are multidisciplinary databases. And if you are doing a search in an area that is to do with maybe mental health, psychology, psychiatry, you would always find anyone doing a search on those kind of specialized areas, they would always include PsycInfo. Now, what is important is by the time you make a decision on which database that you're going to use for your literature review, you have to also be certain that you have access to that database. I have seen quite a number of databases that you have listed. In fact, I think it's only one from your list, to my knowledge, that is free. PubMed is free. But the rest, like Science Direct, Web of Science, PsycInfo, I can see Web of Science, CINAHL, I think you meant CINAHL there. Most of these are subscription-based, so it would depend with the institution that you are and whether you have a subscription to that database. I wasn't going to talk much about databases, but I find it very interesting that a lot of people have posted Google Scholar. Could you post what has been your experience with Google Scholar? Or let me phrase it this way. Google Scholar, yes, is it a database or is it a search engine? It is a search engine that gives you scholarly articles, but it tends to have a bit of hitches. Without preempting the answer, anyone would like to share,
Yes,
Baguma?
can I speak?
Yes, please.
I think the issue with Google Scholar is it has publications that are not peer reviewed. Some of them are not peer reviewed. That could be the downside of using Google Scholar. That's what I know.
You're very right about the issue of quality comes up when you use Google Scholar. And also the issue of reproducibility. There's something about the algorithm of Google Scholar that if you try and repeat the same search, you find it can go totally different from what you had done previously. So the reproducibility is an area of concern. Somebody might argue about the quality, because depending on what kind of review you're doing, are you doing a systematic review? Are you doing a scoping review? But in the case of a systematic review, of course, it's not in my domain to discuss the steps of a systematic review, but just because this issue has come up, you find that within the systematic review, there's an area where you would need to do a risk of bias assessment or quality assessment. And maybe that would take care of the quality aspect. For me, from experience, before I think I really knew how, yes, I like Abib's word of overwhelming Google Scholar can be, was when I realized that you carry out a search and it is not very clear on how you can, now that we're talking about a literature, a systematic literature search, you find it is usually not too clear what kind of search strategy you can apply within Google Scholar. That is one. And secondly, by the time you retrieve the articles that you're looking for, I was quite frustrated with one systematic review that I was doing with one of our researchers at the place of work. It only allows you to export a certain number of articles. Like I can't remember how many articles we retrieved, but we were not able to export all of them. So we had to go back into our manuscript to indicate that as a limitation. And that is the reality of Google Scholar. So if you retrieved, let's say 1,000, for example, if it is something, and Google Scholar can really give you a lot of articles, you will not be able to, do I say export all of them? And there's a reason I'm using the word export. Reason being, when it comes to evidence synthesis, it means all the articles that you retrieve from the various databases, you need to export them or to extract them and put them somewhere, and then you screen. But that's another step of systematic review. And that becomes quite a limitation for Google Scholar. But thank you for your feedbacks and the comments you have given. PubMed is free. We are going to talk a bit about PubMed as we go along. Well, I think I'll skip this for now. I think some of the questions came up as we were moving, just to make sure I haven't missed anything. All right, yes, yes, thank you very much. All right, and now what this topic is about: developing a search strategy. So what techniques do you know or do you use when building a search strategy? Please post on the chat. What strategies have you come across? Have you used? Boolean, that's right. Boolean operators. And yes, and is a Boolean operator, and so on and so forth. There are very many. I think what I can do is, let me move to my next slide. Most of us seem to be very familiar with a Boolean logic. And those are the Boolean operators. I would like, yes, truncation, exact phrase searching, field specification, thesaurus. So what do this mean? Mesh terms, yes, I've seen mesh term, and mesh term falls under controlled vocabulary. And I'm going to explain what this is. So basically, the Boolean operators, most databases and search engines support Boolean searching through their advanced search option. And there are three basic operators, and these are and, or, and not. So when you use and, you're basically combining two terms. And what you're telling the database is that you want this and this term to be within the article. If you use the word or, you're telling the database either this or. And I like just explaining it in a simple way. If you use and, you actually narrow your search. If you use or, you broaden the search, because if you said blood pressure or hypertension, it means you've given the database two options to work with. If you say blood pressure and this, it sticks to those two searches. So it's always advisable, if you're using the Boolean operator and, if there are alternatives for the concept or synonyms, always combine those alternatives with the Boolean or. Medicine and education, baby or infant, these are just basic examples. And you can also combine the Boolean operators, like you say alcohol or drug and abuse, common cold and vitamin C or zinc. So these are just basic examples to show how to use the Boolean. This is just Venn diagram. I don't know whether the gray area is gray enough on your end, but this basically just shows the shaded area that when you use and, how much of the literature is retrieved is that gray area. What you need to take note of is some databases require that the Boolean operator be put in uppercase. So please take note of that. And how you need to know that is, you can, whichever database that you're using, you can check the help of the database and find if the Boolean is required in capital, in uppercase, please ensure that you put it in uppercase. Then there's truncation. When we talk about truncation, there is like a misconception, for lack of a better word, where people assume that whenever you truncate, that you have to use the asterisk. Always go to the help of the database and find out which symbol does this database use. You find some databases use a question mark, others use the hashtag, others use the $sign. So always check, don't assume and just put an asterisk, because it might not apply. The other point of caution I would like to mention is, when you're truncating, there's what we call the stem. If you are looking for information on diabetes, for example, if you say diabete, that is what we refer to as a stem. Then the symbol gives you every ending of diabete. Be very careful on the length of your stem, because just imagine if I decided that I was looking for diabetic and diabetes, but I decided to put the stem after dia, you're going to get diabolic and everything else that starts with DIA. So be careful about the length of the stem whenever you're using truncation. The other search technique is the exact phrase searching. This is where you use quotation marks around the keyword to find the exact phrase. And this is a very, very useful technique. I'm sure you have done a search somewhere and you wonder why you are looking for something. If it is a health-related database, it will interpret it and understand that you're looking for cystic fibrosis. But if it doesn't seem to interpret it that way, let me tell you what it does. It will look for an article where cystic is appearing in one paragraph and fibrosis in another. But if you put it in quotation marks, it will be picked as cystic fibrosis. Now, this is an example of something I carried out just to give you the example of how the results are different. In PubMed, I did a search on kidney failure, but I wanted kidney failure as a phrase. Without the quotation marks, it gave me 222,000 plus results. When I put it in quotation marks, it reduced it to about 98,000. So this is just an indication to show you how that has an impact on your results. Controlled vocabulary. This is an organized arrangement of words and phrases used to index the content. And when you are posting on the chat, some of you talked about mesh. What mesh does is that whenever a database indexes articles, they try and control the vocabulary that is being used. Maybe somebody has done an article and they're talking about cell phones, but the controlled word for cell phone within this database is cellular telephone. And anything that is aligned to cellular telephone will be, that has used any other terminology, if you search cellular telephone, ideally it should pick. So that's basically what it is. There are different kind of control vocabularies in the databases. Some of them, they call them thesaurus. Others would call them different names. It's either index term, keyword, but in the health databases, they would be referred to as mesh. And mesh basically stands for medical subject heading, and it's basically a controlled vocabulary. Now, the advantage of this is that it basically controls the words, the terms into something that is able to put the different terminologies in one concept. However, it has its disadvantage. You may miss new terms or new jargons that have not yet been assigned to an article. And this is very important to take note of. And I think I'll mention it again as we are concluding. If you're carrying out a systematic literature search, it is recommended that even though you identify the controlled vocabulary or the mesh term, for example, if you're using PubMed, it is recommended that you combine the free text or the keyword with the controlled vocabulary so that you don't miss out on maybe an article that was maybe added on recently, had not been assigned the mesh term, or maybe it was old and you wanted to cover something that was before mesh terms were assigned. So please always have that in mind. Now, putting all this together, remember we talked about PICO. If I had a PICO, this is how I would apply it. I would put my terms within the P, the I, the C, and the O. All you need to remember is anything that comes in within the one box, if I can call it, like population, moving down, the Boolean operator is OR. If you go to intervention and it has different alternatives, apply the OR. Now, when you go into the database and you want to combine the P, the I, maybe the C, and perhaps the outcome, you now combine it with the AND. So if you're going down this way, it is OR. And the minute you start moving across, you use the Boolean operator AND. So putting this into practice. Step one, you would begin by searching for evidence on a topic or a question. In this case, my topic is effectiveness of telehealth in rural areas. Step two, you extract search terms where you, yes?
Yeah, sorry, Nasra, let me interrupt you a little bit. Please, I want to clarify with the participants that we are not requesting for your emails, so you don't have to put it in the chat box. We don't know who is starting the train, but we would not advise that you share your email in the chat box, please. Thank you very much.
Okay, thank you. Thank you, Fortune. Step 2, extract the search terms. Break the topic into key concepts. Now, this slide is very important that you pay attention to this slide because it informs the activity that we're just about to get into breakout session to combine everything that we have learned. So you develop a topic or a question. You break the topic into key concepts and you say whichever framework you're comfortable with. Like in this case of effectiveness of telehealth in rural areas, my population is rural areas, intervention is telehealth. I don't even have a comparison. And this is a good example where I have used PICO, but I didn't have a comparison. My outcome, I'm just looking at effectiveness. But of course, I would need to look at the synonyms and related terms for each of the concept. And step 3, I combine the terms using the various search techniques, the Boolean, the truncation, the phrase searching, and the control vocabulary. For now, we can forget about control vocabulary because you can't really know the control vocabulary from the top of your head. You'd have to go into the database. So in this particular case, I would use the Boolean operators and or. For truncation, for telehealth, I would maybe use an asterisk, maybe to give me the extension of telehealth. And because I have rural health, I'll put it in a phrase search so that it gives me exactly the way it is. And now this takes us to the activity of putting this together. And I'm sure Fortune is going to help me with the breakout session. It shouldn't take so long, and don't look for anything too complicated. This is just for the purpose of trying to conceptualize some of the things that we have learned. So the task for this breakout session is within your group, you discuss and agree on a clear research question, extract the search terms, list some of the synonyms for each of your concept, and put a very basic search strategy, and we will come back. How much time do we have for this, Fortune? Maybe how much time is good enough for this?
Nasra, you can advise, but I was looking at 20 minutes, or what do you think?
Okay. All right. I think we can take around 15 minutes, and then we can have some 5 minutes in case people have some feedback or challenges they had within their group. So Fortune, over to you for the breakout session.
Thank you, Nasra. Please, could you give me like 4 minutes? Maybe we can take 1 or 2 questions in 4 minutes. I'm just trying to set it up now.
Okay, we will be glad to have access. All right, I'm just reading. I'm available. Okay, collaboration, single word. Oh, that is sad, Stella. Are you still having a problem seeing my screen? Adewosi, yes, you raised your hand.
Okay, thank you very much, ma, for the teaching. I just wanted to ask, is it possible for us not to have outcome when you are making use of the PICO framework, like maybe a topic like considering the moral hazard in health insurance, and there is no outcome? How do we use the PICO framework in?
That's a very good question. The way I go about the issue of the outcome, there are times I actually don't, when I'm doing the search, I tend not to introduce the outcome immediately because sometimes, let me first answer your question. There is no way you cannot have an outcome. Let me put it that way. And why so? You could be looking at a study that has the same problem or population and the same intervention, but it has a different outcome. So within your question, it's important to show an outcome can be a simple outcome, like my example where I said you're looking at an effectiveness of a certain intervention, one. Or maybe you're looking at an intervention like Maybe you want a painkiller. Maybe a patient has a certain problem and you want to give a certain intervention to reduce pain, or maybe to do something. So that becomes the outcome. So you find in all questions, there has to be an outcome. And the purpose for that is by the time you're doing the review and you're looking for the studies have to be aligned to a similar outcome or outcomes that you have. I hope that answers. Now, depending on how elaborate your study is, I mean, I would rarely, if one of my outcomes was a basic one, like effectiveness, I would not put the word effective in the search string. I mean, it's neither here nor there. I would maybe do exploratory search and see what is being retrieved before I decide what to introduce. And we're going to talk about that as we go along. I hope that answers your question. But by the time you're developing your search string, ensure there's an outcome, because that will guide the literature that you're going to include. Remember, when you're doing a review, whether it's a systematic or a scoping review, you have to have an inclusion and exclusion criteria. So it has to answer something that has a very focused outcome.
Thank you, ma.
Okay, Nasra, we are ready, so you can just let me know when you want us to go into the breakout rooms.
Over
And
to you, Fortune. Yes,
okay.
You could just go to the breakout.
Okay. So just I wanted to know if the participants have any questions concerning the activity, because the time is limited, and when you're in the breakout room, you're expected to just start working. So if you have any question, this is the instruction. You could just ask. Thank you very much. I think I can just allow 30 seconds for that.
Sorry, I have a question. I just entered late, so I didn't understand what we are to do in the breakout session.
Oh, the question is right. What I did is we're just putting together all the different things that we have learned from the time I started. And I gave an example like this, which is what you're going to discuss in your various groups. And I say, don't make it too complicated. This is just a case of contextualizing the basics of the literature search steps. You come up with a question or a topic, you break it into concepts with a framework of your choice, or no framework. Don't feel tied to the frameworks if you're having a struggle with that. But I had explained a bit about the framework in case you're struggling to break it into concepts. If you break it into the concepts, do you have any synonyms that you want to attach to that? And from there, come up with a basic broad search technique. So those are the steps that you're discussing within your groups.
Okay. Okay, thank you very much, everybody. So I just wanted to mention that it's for 15 minutes. Then we can have, I think we have additional 2 minutes for you to wrap up. The different groups are named. There are 12 groups you can join, and they are named according to different cities in Africa. You don't have to join your own city. You can join any city randomly and just work with the people there. This has not been pre-assigned, so nobody knows who is going to join which. So you just be free and join anyone that is comfortable for you. So if you're experiencing challenges joining, you could let me know. But then you would see, once I start the breakout room, you would see the breakout room button at the top left corner of your screen if you're using your phone. You could see it at the bottom right corner of your screen if you're using your PC. So I've gone ahead to open the rooms now. Okay. Nasra, can we take presentations maybe for like 2 minutes, 3 minutes max?
Yes. From about 2 or 3 teams, so maybe they can just unmute and proceed.
Okay, great. So if possible, they can share their screen as well. What do you think?
Okay, let me stop sharing.
Okay. Please, is anybody ready to share their screen and present?
Yes. Nairobi, please.
Okay, go ahead, Nairobi. Nairobi, go ahead, please.
Yes. Please, can you see my screen?
Not yet.
No.
Okay.
Not yet.
Okay. All right. Sorry.
Romy.
Yes. Can you see it?
Yes.
Yeah.
It's okay.
All right. All right. Excellent. Excellent. Thank you very much. Good afternoon, facilitators, my colleagues. So this is our practical or session work from Nairobi team. So initially, just as was mentioned, part of the exercise to bring a topic. So we brought a topic on the effect of exercise on improving weight loss in obese patients. So we actually thought over the topic. It wasn't like this initially. So we also broke it into PICO. So the population, which is obese patients, and of course, synonym overweight,
Sorry, please, can you
intervention,
put it on the
exercise.
slideshow so that we can see? It's very tiny.
Okay, sorry about that.
You can see, they can
Zoom
just
now, they
go
can
to
zoom. They can zoom their phone now.
Yes, so
It's better. We
so
can see. Thank
excellent. So the intervention is exercise or physical activity, then comparator is normal activity or no activity. You can remove that. So the outcome is weight loss or weight reduction. So we put this, we develop a SaaS strategy. So, and we connect them with Boolean operators. So obese patient or overweight, because they are synonyms, and we connect it with an exercise or physical activity and weight loss or weight reduction. So thank you. This is our little piece from Nairobi. Have a nice day. Thank you. Thank you, my team.
Thank you. That's a very nice one. And I like this one because it explains the question that came up about outcome, because you can see a simple outcome like even weight loss or weight reduction. So there has to be really, from what I know with the frameworks, what is not you would not find in all concepts is comparison, but the outcome, there has to be something that you're trying to investigate or something. So maybe thank you very much. You can stop sharing so that we get from another group before we wrap up. But I think we've basically gotten the gist of it.
Okay, good evening.
Sorry, just a minute. I would want to mute everyone, so I'm going to unmute you. You can just raise your hand, then I'll mute you so that it doesn't interrupt the conversation, please. So I think this is a mem on call. I'm just going to unmute you now. Okay, so I have unmuted you. Please go ahead. I'm not sure. Please, who is presenting? Okay, Dan.
Oh, sorry. Okay.
Okay,
can I
Dan,
go ahead?
Yes, please, go ahead. From which group?
Chigari.
Okay.
Okay, thank you. My name is Dan from Uganda, but I'm in group Chigari for now. So this is our question. And I've not included all members, Benjamin and Jonathan and others. So we came up with a question of effect of caffeine consumption on academic performance of students. And we used PICO without a comparator because we didn't have it. So for P, which is supposed to stand for the population or the problem, we had the students because we are measuring the effect of caffeine consumption on them. Then the synonyms for students, we thought of university students or college students, depending on the nomenclature of the institutions. Some papers may refer them to that. Then the intervention, we thought of caffeine consumption, caffeine as an intervention, and different papers normally study these this is element differently. Some may call them stimulants, others may be referring to consumption of coffee or excess coffee or energy drinks. Then the outcome, we noted it as academic performance, which someone would refer it to academic success, good grades, improved grades, etc. And we combine the synonyms with the Boolean operator OR for the population, the intervention, and the outcome. And we came up with this beautiful search strategy. This one may be tailored to PubMed because of the way we have put it. That's what we came up in that short time. Thank you.
Thank you, Dan. I think, Fortune, we can take one more, then we wrap up.
Nigeria is here.
So I am just going to call. I'm just going to call the hand that is raised, and that is Gabriel. Gabriel, could you please let me? Okay, I think someone has already shared screen. Okay, go ahead, Patrick. Patrick, which group are you from?
So I think someone has shared their screen already. I'll just lower my hand so Patrick can go ahead.
Okay, Dodoma, please go ahead.
Okay. Thank you. Good evening. I'm Patrick from the group of Dodoma. We are trying to see the influence of ICT. So our question was, how do mobile-based weather advisories influence the adaptation strategies of smallholder farmers in semi-arid regions of Tanzania against drought events?
Because when other African countries are speaking English, it's always showing their intonation.
Yes. So you can see now we have an intervention, ICT, mobile-based weather advisories and climate shock as mitigation, adaptation strategies against drought events. Then we have a context, smallholder farmers in semi-arid regions of Tanzania. So we opted to go with a framework, which is PICO with this, but we got stuck with the comparison where with the implicit intervention in this type of studies. And you can see the population intervention outcome in the context is Tanzania. So we tried to come up with this search strategy. I don't know if you are following.
Yes, we are following.
Yes, we are following.
Yes. Okay.
Yes, and I like the fact that you've talked about not having a comparison. Like I had mentioned, it's not in all cases that you have a comparison. But what I like about your table is that you have a section for the synonyms, so that you will remember that all the synonyms will have or. Then once you work them out, you then combine with and, then the other synonyms with or. And I'm just going, as we are wrapping up, I'm going to explain the importance of, it's something we call line by line searching, so that you don't lose track of exactly what it is you're doing. So I'm going to explain a little bit of how it is you have done it there. Thank you.
Okay, thank you.
Yes, like Tanzania, you also have to remember that some studies could be, is it that it was East Africa? Is it developing countries? Is it low economies? Is it low middle income countries? All those terminologies, maybe you find Tanzania has been mentioned in that. So that is how you apply the synonyms.
Thank you.
All right, so I think in the interest of time, I can just share my slide just to explain some of the things that I have seen that have come up.
I have a question, if you may.
Yes.
Yeah, actually, we had a challenge in our group because the kind of question that we had became quite complicated for us to determine whether it would pass the test for PICO.
Okay, now that, and I think that's why I had explained that it's not all cases that you use the P code. It depends on the question. And if you find it doesn't very well fit the P code, maybe because of the components or whether is it a social science or whether it's a qualitative, there are all these other different frameworks. But you find discussing frameworks is like a topic on its own. And there could also be another aspect, and maybe in the next webinars, we may have to, I mean, that would be Fortune as is organizing. Even when it comes to reviews, there's also the importance of how do we develop the question. So those are the things you'd have to think about, and that's why I said for the sake of this particular exercise, we just needed to make it very basic so that we stick to the objectives of this, which was more about the search terms. But remember, they are guided by the question. So if the question is like maybe either too broad or too narrow, or it's really not giving you any focus, again, that would be a challenge. It means the challenge would arise from the question, and that is like a whole topic on its own. But just remember, don't feel tied down to PICO. That's what I think, that's a message I just need to communicate for now.
Okay, are there other alternatives that you would use apart from PICO?
Yes, I'd explained there is a PICO with a small, that is phenomenal of interest context. There's SPIDER, there is SPICE, there's Eclipse. So if you look at the literature, you would find more than, there should be now almost 10 or thereabout. But I explained that the reason we hear about PICO a lot, it's because reviews, the history of reviews is in the health sciences, and the first framework that came up was the PICO. But because of the evolving of the disciplines in the reviews and the quantitative versus the qualitative, other frameworks evolved, and there are many of those.
All right, thank you.
Yes. All right, so thank you for that feedback and the exercise that you have done. We've just finished. Now, in line with carrying out a systematic search strategy. So once you have done what it is, you have to remember that it takes time to build the strategy, because there's what they call harvesting of concepts. And harvesting of concept means that you start as a team, because reviews have to be done in a collaborative way. So you either look at the thesaurus to look for concepts to add. And one thing that is also very important when you're doing a systematic literature search is to carry out what we call an exploratory search. And the essence of this, it's the preliminary check for your strategy development. Because even as you're doing an exploratory search, you might pick something, or you see that your study, whatever is being retrieved, is totally unrelated. And it allows you to go back into your search strategy and find out what is making this search not retrieve close to what it is that you're looking for, or why is it off, for lack of a better word. So you find with exploratory search, it helps you refine and identify also key terms for a more robust systematic review search. So when you're developing your search, you start by doing so in one key database. So depending on your topic, and you mentioned quite a lot of databases when we had begun. So you have to think of one key database that you want to apply your exploratory research. Like in the health sciences, one database that would always come to mind is PubMed. So typically you start with the database that you are likely to find the most relevant results. And remember, it is important to also work with a database that you have access to. This can help you gauge how many total screening results you may be looking at. And just to respond to a question that I saw in a chat, somebody asked, how many articles are you supposed to retrieve? There is no rule of whether it should be 1 or 100. I have seen studies, I have worked with teams that, like, there was one that even gave us 2,000 articles, and it was a lot. It took such a long time to screen that because it really depends on the topic. And at the end of the day, whether you got 100 or you got 50 articles, what will inform somebody who's looking at your review is will go back into your protocol, your search strategy to find that it was exhaustive and it was well structured and you have captured all the databases. Because if you show a well structured search string and your databases of choice are the recommended or the required databases for that particular topic, then whatever you get is what you work with. I remember there was once a review team I joined, and it was a team of surgeons. And I thought there was something wrong I was doing because I was used to getting so many results. And this particular one was giving me very few. It gave me, I think, from what I had done in the past, I was considering 100 like very little. Because I was like, once you screen 100, we might be left with nothing, and I was worried. But when I talked to the principal investigator, he told me that there might be the reason that maybe we are not getting so much, despite the fact that we had exhausted the databases and our search string was as exhaustive as it could be. It was an area that has not been researched. So you find when you work collaboratively, there are people even who know whether is this an area that maybe not much has been done. So it means those are some of the things that you'd come across. So a database like PubMed, like those of us who are in the health, and because PubMed is also free, we have access to it. So in my case, you find that when I am working, doing an exploratory search, I would always start in PubMed because of its accessibility and the combination of the keywords and the mesh terms and all those Boolean and so on and so forth. But you also have to remember, when we talk about PubMed, this is just some background, although this was not supposed to talk about a particular database because that would not have had time. I know we tend to use the word PubMed and Medline interchangeably, but you find that they need to explain this a little, that PubMed is actually the platform where you access Medline. And the reason I'm explaining this is that you will find there are some people who may search Medline, but via Ovid, or they may search Medline via EBSCO, for example. So why I'm mentioning this is that it is important, whichever platform you use to search a database like Medline that sits on different platforms, at the point of documenting for for you to be transparent, you have to say searched Medline on PubMed. Because if somebody tried to reproduce the same on a different platform, it would give different results. And I'm going to explain this. So you finalize your strategy in the key database, and the final strategy may be reported in different ways, whether line by line or block format. And this is, I wanted to touch on that last presenter, how you had your different lines of your synonyms for the population, your intervention, and so on and so forth. So this is an example of what a such strategy would look like. So where they had the population, they had the intervention. And you can see for each search, look at number 1, 2, 3, 4. Until
Sorry,
number
Nasra.
1, 2.
Sorry, Nasra, I just want to mention that you're not sharing your screen.
Oh. Oh, sorry about that. Sorry about that. Yes, so I was just talking quickly. Sorry about that. I will just go back just quickly to talk about the importance of starting your search in a key database. And this is for you to identify which is your key database. And like I said, in the case of health sciences, in most cases, we start on PubMed because PubMed tends to be freely accessible. Or maybe if you're doing in another field, you'd have to find which is your database of choice to do what we call, this is what I was referring to, carrying out an exploratory search. And the essence of this is to fine-tune your search, you review your search, you identify more key terms, so you continue building on that. So this is very key when you're doing the search. So in terms of PubMed, I thought I needed to mention this for those who are in the health sciences, that there seems to be some confusion where people use PubMed and Medline interchangeably. And you find that Medline sits on different platforms. You may be accessing Medline on Ovid or Medline on EBSCOR or PubMed. So at the point, remember I had said, even for your search strategy, you need to document which database. So if you search Medline, you have to tell us it is Medline PubMed, or is it Medline or Ovid, or is it Medline EBSCOR? The reason for this is because of the reproducibility and being transparent. If you don't indicate the platform, what would happen is someone might try and apply the same strategy in a different platform and will get different results. So the final strategy may be reported line by line or block by block. And I was alluding to one of the presenters, the last one, just to get an overview of what a detailed line by line strategy looks like. Now, if you look at this, look at the numbers at the top. If you see the population, there's 1, 2, 3, 4. And this has been combined in number 5, 1 or 2 or 3 or 4. And the results are there. And I always tell people, don't get intimidated by the big numbers, because once you get to the bottom, you can see your numbers are 47,621, 51,000. But look at the bottom, 23. When you combine 5 and 14 and 22, you end up with 74. But the advantage of line by line is that when something goes wrong somewhere, you're able to go through the line and find out where did you make a mistake, and you're able maybe to clean it up and then run the search again and combine differently. So you can either do a line by line search. This is also another example of line by line searching. And the databases always have, in the advanced search of most of these databases, there's an advanced option where you're able to combine your searches. This is just a block format of the search, and this is putting all of it in one format. But it's recommended that if you're dealing with your population, get all your synonyms, put them together. get the mesh term for your keyword with the or, put it together, combine that with the key text. It's one set. Go to the next like that, as systematic as you can be before you combine the final search. And there's also use of filters and limits. There may be some concerns about applying filters or limits in some of these searches. And I think I had mentioned this at the beginning, like especially where you want to combine the mesh term, the control vocabulary, and the keyword, it is always recommended that you combine the indexed field and the subject heading with the text words together so that you don't miss on any. So some of the maybe filters that I see being used could be the methodology, because there are those, depending on the kind of depending on the kind of intervention you may be doing in the health sciences, you have included in your inclusion and exclusion criteria that you can only include randomized control trials, for example. So you see that could either be a search string or it could be a filter, and that's a topic that can be discussed at a later time. Or maybe it could be the geographical location, especially where you're looking for information within a certain area, like it could be the low middle income countries. So why you need to search strategy for different databases is because the search functions and syntax vary across the various platforms. So once you develop your search and you fine-tune it in your key database, it's not a matter of copy and paste. You need to understand the functions and the syntax for the next database that you're moving, and you adjust your database, you adjust your search string accordingly. Now, for example, you find mesh is the control vocabulary for the health databases, whether you searched Cochrane or you searched PubMed. But if you went to Scopus, you will not find that they're using mesh. So you would need to check, do they have a thesaurus, and you apply accordingly. So always remember, whatever search that you apply into other databases, factor the functions and the syntax for the different platforms that you're using. Now, this was just an example to show you for Medline, where you have Medline Ovid, Medline PubMed. Hypothetically, the content you think, yes, this is Medline, regardless on whether it is on PubMed or Ovid or EBSCO, hypothetically, the record should be consistent. But that is not the case. This is an example to show that this same search of neoplasm and immune and so on and so forth, even though some results, there may be a small difference, and this was something that was published, where this search was done on Medline, PubMed, ProQuest, EBSCO, Web of Science, and Ovid, and you can see the difference in the results. So the essence of this particular slide is to show you that even though you are searching Medline within the health sciences, it is important that you document which platform you used, and if you're moving from one platform to the other, you need to indicate which platform that you searched. Final tips and other considerations: save your search strategy. You could do it in the platform's account if it gives you that provision, or in a running document, maybe offline. And somebody asked about that in the chat. You can export your searches as you go along, as you build them, so that you don't lose these. Most of these platforms have an option where you can either create an account so that you're able to save and not lose your search. Proofread your strategy, and it's also recommended when you're working at a team, have somebody peer review your search to minimize the errors and identify the missed terms or reduce the risk of bias. So in a nutshell, those are the steps that you need to follow to make sure that your search that you've done is done in a systematic way. Thank you very much for your attention, and over to you, Fortune.
Well, thank you very much, Nasra. This has been super engaging and enriching. Unfortunately, we, like every good thing, we have to come to an end. I want to crave the indulgence of the participants for us to maybe take one more question. We are already 11 minutes beyond the time allocated, or 12 minutes beyond the time allocated for the session. So Nasra, you can see the reactions from the participants. So it means a very good job done. Thank you.
And thank you. It was a very engaging group of attendees. I actually enjoyed here. And for Fortune, thank you for the opportunity and the invite to give this presentation.
Yeah, so I think we can maybe share your email with the participants. They can. Do you think that they can write to you directly with their questions because of time?
Yeah, because I think I can see we are 13 minutes past the time, so that we respect the hour. So I just hope for those who, I'm sure we are all at different levels with this, but I always say in every learning, even though you pick one little thing, it's better than nothing. And for those who maybe could be experts in this, I just hope this was a good refresher for you. Okay, I can see quite a number of hands. I'm not sure. Do we just take this offline?
Yeah, I think we can do it offline. Maybe you can you can share your email and they can write to you.
Maybe those who want to stay, they can stay and listen to the questions. Those who they don't want, they can. Just a suggestion.
It's getting dark where I am, and I was holding people in the office.
Okay.
We are 2 hours ahead. It's already past 6 p.m.
Oh, sorry.
Yes,
so okay,
thank you so much.
Yeah, I just wanted to mention that I've shared a link to our platforms, including WhatsApp community groups, so you can join and you can throw in some of your questions. I believe that maybe some of the questions you have, aside Nasra, some of our team members can respond to them. So please feel free to throw in your questions or call for collaborators or mentors or librarians in our WhatsApp or Google group. So thank you very much, everybody. Of course, we share the recording and we share the slides with you alongside details for the next session, which should hold next week, Friday. Nasra, I really want to appreciate you for making our time for this. It was a very fantastic opportunity. I think in the absence of anything, we can call it a day. Thank you very much, everybody. I hope you enjoy the rest of your evening.
Thank you.
Thank you. I'm looking forward to the next session.
Thank you so much.
Thank you.